Hey guys, so this is a brand new episode of the flashcard series, and in this episode I would be discussing 4 more flashcards which would be really high yield, so stay tuned. So the first fact I want to discuss with you is about the difference between the ondansetron and metoclopramide. Basically, these two drugs, these are the class of antiemetics that they are used to prevent the vomiting in certain scenarios. So metoclopramide is basically a dopamine antagonist, whereas the ondansetron is a serotonin receptor antagonist. Whereas the metoclopramide is promotility agent, and ondansetron can cause constipation. So this is an important difference between these two, that ondansetron can cause constipation, whereas the metoclopramide is a promotility agent. The next card I want to discuss with you is that the most common cause of the spontaneous lobar hemorrhage in the adults more than 60 years of age is the amyloid angiopathy, which is subsequently leading to the Alzheimer dementia. The next card we're going to discuss is about the clinical scenario in which there is bilateral foot drop, there is glove and stocking, distribution of the numbness, ankle jerk is gone, and symmetric paresthesias are there in the lower limbs. So these kind of situations in a cancer patient particularly would point towards the Vincristine induced peripheral neuropathy. This is a really important point because as people go through the chemotherapy, you need to know the side effects of the chemotherapeutic drugs so that you can improve the quality of their living, as well as these kind of patients are already very depressed. So we have to strive to a goal that we have to decrease the side effects of the chemotherapeutic drugs. Now, the next point is about the leuprolide. Leuprolide is basically a GnRH agonist, and it would inhibit the ovulation. That's why it is used for the endometriosis. Next is a drug which I want to discuss with you is cilostazol. Basically, it is used for intermittent claudication in case of Buerger's disease. And the another drug is dipyridamole, which is used in the cardiac stress testing. Now, another point is about the theca lutein cyst. These are basically due to the ovarian hyperstimulation, and these occur in the gestational trophoblastic tumor or multiple gestations, or in case the people the women who undergo the infertility treatment. Such patients also present with theca lutein cyst. Thank you, and stay tuned for the next episode.